Thank you for joining us for a discussion about the Safe and Sound campaign and the Safe and Sound Week. Safe and Sound campaign is an undertaking that OSHA and a number of partners and co-sponsors have put together to say that every business, every workplace needs a safety and health program. Safety and health programs are how businesses manage safety in their workplace and how they drive safety culture. Safety and health programs have lots of benefits. Number one, they reduce injuries and fatalities. They can save money for the businesses that spend on workers' comp, on lost production time. It can increase productivity and improve worker satisfaction and employee engagement. There are three main components of a worker safety and health program, and that's management leadership, worker participation, and a systematic approach to find and fix hazards. There are lots of different models out there for safety and health programs. OSHA has its own recommended practices that we promote as well as through our SHARP and BPP programs. The National Safety Council has the Journey to Safety Excellence, which is also targeted at small businesses. And then there are other ones targeted more towards large businesses like the ANSI standard, which is primarily for American large businesses, and OSAS, which is really targeted at large businesses that have an international presence as well. As part of the Safe and Sound campaign, we started the Safe and Sound Week. And now, slide. Page up. Page down. Okay, while we're solving technical difficulties, Safe and Sound Week is June 12th to the 18th. And it's an opportunity to show your commitment to safety and health for your business. This is an event that's co-sponsored by OSHA, National Safety Council, American Industrial Hygiene Association, American Society of Safety Engineers, and NIOSH. Now, we're a little bit behind the times because this slide was made yesterday. Instead of 73 partner organizations, we're now up to 75 partner organizations, and we're adding more almost each day. The goal of Safe and Sound Week is to help businesses do things that will raise awareness and understanding of safety and health programs. If you're a business that already has a safety and health program, this is an opportunity, again, to show your commitment to safety and health. And it's an opportunity to promote the types of things that you're doing in your workplace. If you're a business that doesn't have a safety and health program, this is an opportunity to dip your toe into the pool and try out some things around safety management, around management leadership, worker participation, and finding and fixing hazards that'll get you started on the road. We can move on to the next slide. To understand a little bit of the thinking behind safety and health programs, at OSHA, we have a full range of employers, from some who have very little commitment to safety to those that have a great deal of commitment to safety. And we have a wide range of tools to address those hazards, from criminal penalties to normal inspections. And again, the folks that fall into the normal inspections and civil penalties are places where we're having fatalities and catastrophes, where we're getting worker complaints. For places that have repeat offenses, those folks get put in our severe violator enforcement program. And then as employers move to a greater commitment of safety, what we find is that most of those folks we don't interact with very much at all. Those folks are looking at information on our website, or if we're interacting with them, it's at webinars, meetings, and conferences, but it's generally a positive interaction. And then all the way on the right side, we have our recognition programs. That's our SHARP and BPP programs, where we see those folks an awful lot because we're validating that they, in fact, have an excellent safety and health program. What we're trying to do is shift the curve. By increasing safety and health programs, that, we believe, will change the way that employers interact. They will choose to be in a different region of the curve, and they'll see the benefits of safety and health programs, including, again, reduced injuries and fatalities, saving money, increasing productivity, and improving engagement. And so that's the thinking behind the entire Safe and Sound campaign, is improving the uptake of safety and health programs. That doesn't mean that you need to go to recognition programs like SHARP or VPP. It doesn't mean that you even need to interact with OSHA at all. Again, we love the National Safety Council's Journey to Safety Excellence. We love ANSI. We love OSAP. Or your own model. Any of them work as long as they have those core pillars of management leadership, worker participation, and a systematic approach to find and fix. And now let me turn it over to Heather.
Thanks, Andy. Our next presenter is Bernardcarnitine. He's the president of the New Jersey section of the American Industrial Hygiene Association. He has nearly 40 years of professional and business experience in regulatory compliance, insurance, national defense, environmental services, and consulting. He is also currently the managing partner of the Windsor Consulting Group, a certified industrial hygienist, certified safety professional, AIHA distinguished lecturer, and AIH fellow. He is the current president of the New Jersey section of AIHA and board of directors member of Workplace Health Without Borders. All right, well, we'll turn it over to Bernie here and get started with his presentation.
Well, thank you very much for allowing me to present today's Safe and Sound business session. Founded in 1939, the New Jersey section of the American Industrial Hygiene Association decided to have a mission to promote industrial hygiene profession, increase the knowledge of principles of practice through an interchange and dissemination of information, promote the study and control of risk factors affecting health and well-being of workers, and collaborating with other business partners on the awareness and control of hazards. As president of NJHA, we seek to network and collaborate closely with our membership, other nonprofits, regional business entities, industry, stakeholders, and regulatory bodies to drive safe and health practices in the workplace. NJHA is closely aligned with the Pennsylvania and New York Metro sections of AHA, as well as the Penn Jersey and New Jersey chapters of the American Safety Society. They provide membership support for management programs. They translate this into a significant return on investment, improve morale and well-being of workforce, and improve human performance and productivity, reduce both indirect and direct costs, and champion a vested interest of sustainable continuous improvement for all stakeholders and shareholders. Other vested New Jersey organizations include the Mid-Atlantic Biological Safety Association, the Alliance of Hazardous Materials Professionals, and Workplace Health Without Borders, as we mentioned. The New Jersey State Industrial Safety Committee, under the auspices of New Jersey Governor Chris Christie, also provides incentive awards for member companies who seek to maintain or improve their lost time injury and illness records or achieve the OSHA VVP level of recognition. A whole goal of NJHA is to reach out to the membership with engaging speakers in monthly dinner meetings, informative newsletters, social media content and news, professional development corners, summer career path training for board certification, and we also hold a professional development conference and exposition annually to discuss the many current issues that impact all of New Jersey business and industry based on the state of economy, society, governance, and political climate. All of this information can be used by business and industry to construct and manage their health and safety programs. Membership in NJHA, as well as other stakeholders, provide a strong voice on public policy, regulatory process, and access to resources for professional training and board certification to advance their career. Collectively, we share a body of knowledge about health and safety issues facing our membership, train future leaders in industrial hygiene and occupational health, provide training and education for career professionals and board certification, review compliance requirements, collaborate with other aligned business partners, and provide leadership skills to navigate uncharted waters so that together we can protect people, property, and our planet. So why is this important? Nearly 50 workers are injured every minute of every work week. On average, 17 workers die on the job every day. It's estimated total costs for occupational injury and illnesses in the United States as of 2007 were estimated $250 billion, of which $192 billion was related to injuries, and the cost of illnesses was related to about $58 billion. According to the 2014 Liberty Mutual Workplace Safety Index for serious non-fatal workplace injuries, it costs nearly $60 billion in workers' compensation costs. That's more than $1 billion a week spent by business on avoidable injuries. OSHA has estimated a cost savings between $4 to $6 for every dollar that would be spent on health and safety management programs and worker training. Now that's business value. So let's put it in another monetary perspective. To cover a cost of a $500 accident, an employer would have to bottle or sell 61,000 cans of soda, bake and sell 235,000 donuts, deliver 20 truckloads of concrete. So you can see the importance of having these programs in place. So every day, health and safety professionals need to brief their leadership about the business value, about what we do and why we do it. NJHA provides those tools for turning shared information into business opportunity for cost savings and cost benefit. In turn, top management must use available resources and human talent to demonstrate sustainable commitment, communicate safe work practices to workers, and set policy, programs, and procedures to delegate responsibilities that encourage and empower the workforce. Managers at all levels should prioritize safety and health as a core organizational value, establish clear goals and objectives, utilize existing resources and support for programs, and set a good example by promoting a sustainable behavior both on and off the job. Profits should never trump the uncertainty of risk or the liability of inherent loss. This is a downward spiral and a losing proposition. Supervisors play a vital role in creating a sustainable business culture and facilitate enforcement of company policy, written programs, and operating procedures. Supervisors also have a responsibility to drive how the business gets done at all levels of management, but more importantly, influence organizational culture. Improving hazard recognition skills by workforce and leadership is a vertical up and down work in progress. It requires the financial assets, human talent, commitment, and dedication to preserve the company brand while conserving allocated resources. The objective is to maintain working conditions and a working environment so everyone who comes to work can return home healthy and safe. Workers and their representatives should share the same synergy in setting goals, identifying and reporting hazards, providing viable solutions, investigate the cause of incidents and near misses, and track progress. All workers, including contractors and temporary labor, must understand their roles and responsibility at host employer work sites and do what they need to do to protect their workforce, which may be independent of the host employer's obligations. Workers should openly communicate with management by reporting concerns without fear of retaliation. Health and safety by itself should be a core value of corporate performance and personal evaluations. Companies can use job health and safety analysis to define the individual steps, identify hazards, recommend corrective actions necessary to ensure that the work is done safe and a timely manner. Standard operating procedures are a very useful tool to protect workers and exposure to inherent risk. Workers and management should always talk about health and safety at meetings, briefings, and provide tool talks to workers so they can carry out their job tasks. Membership in AJG and other nonprofits provide a cost-effective training for purpose with health and safety responsibilities. More managers and supervisors should receive this kind of training on health and safety concepts, understand their responsibility by position in the company, and respond promptly to real concerns. Because after all, the most valuable resource of any organization is its best employees. All workers should be able to recognize workplace hazards and use the controls that are measures that are available and provide themselves a safe and sound work environment. When risks become unacceptable, workers and their employers should consider a stand down to reset and make things right. NJHA has a vast array of human talent and educational resources to discuss issues about medical treatment, medical surveillance of biological monitoring of chemical and other biological and chemical and physical risk hazards to complement routine physical exams. Business needs a comprehensive understanding of timely medical treatment, handling of claims to get workers back to work, and ways to prevent fraud and abuse, provide accurate information for mishap or near-miss investigations, and to comply with OSHA reporting requirements. Plan, Do, Check, Act cycle is a four-step model for carrying out change. Just like a circle perimeter has no end, the PDCA cycle can be repeated again and again for continuous improvement. Membership in NJHE and other nonprofits provide gainful information on engineering and administrative controls to reduce risk, limit liability, and understanding how best to protect workers. This resource can be also used to help identify gaps in policy, program, and procedural shortcomings. Recent analysis of business interventions identified several key factors that play a critical role in operating costs. These factors were classified by the perspective of the company, workforce, economy, and society as a whole. This model for the business interventions is represented in the following floral diagram, which has basically 4 essential elements. Capital expenditures for new equipment and labor, degree of effectiveness of the control measures in place, increased productivity by innovation in technology design or retrofit, and finally, protection of workers to increase productivity. So why are we talking about all of this? Despite emphasizing the business value of protecting workers and driving innovation technology enhancements, many organizations still operate in a vacuum. As a result, opportunities for cost benefit, effectiveness and savings, lower liability and risk with workplace improvements, and reduction in injury and illness are missed. Interest in health and safety measures as indicator of corporate governance are gaining more traction among business leaders. By establishing a robust strategy, program inspections, surveys and audits, and performance metrics, the newfound earnings can be used to hire new workers, purchase new and additional machinery and equipment, and open new markets or new locations. The goal for all stakeholders is to understand that real business value directly correlates to good policy, programs, and procedures that are tied to leadership commitment and investment, worker participation, and a systematic approach to find, report, and fix hazards in the workplace. Shareholders also can reap rewards from high profit margins, reduced operating costs, liability and risk, which translates into a better brand, image, and reputation. Social responsibility and sustainability can attract more lucrative investments and growth. Workplace health and safety is a sound business practice that concerns limited resources and maximizes business profits. Well-written and enforced programs can control systematic hazards before they can cause short or long-term injuries and illnesses, property loss, unnecessary capital expenditures, and damage to reputation and future earnings. Participating in Safe and Sound Week and working with NJHA and other stakeholders can help start or re-energize your existing program. Also, there are many governmental and online resources available to help companies understand and control the risks facing the business or industry. NJHA and other business partners provide the capacity and network with onboard certified and career path professionals for additional guidance. Organizations of any size or industry should grab onto this bona fide opportunity to engage and empower their workforce and showcase their internal and external commitment to excellence. Because in the end, health and safety is about business relationships and networking to protect people, their lives, and livelihood, as well as products used and manufactured, public health, and the environment. If more effort was given to this endeavor, more business could reap the financial reward for greater profitability, prosperity, social responsibility, and sustainability on a global scale. Thank you for allowing me the time to deliver this important message.
Thank you very much, Mr. Fontaine. We really appreciate your presentation and making the business case for health and safety excellence. Next up, we're going to hear from Dr. Thomas Cunningham. He's a behavioral scientist and chief of the NIOSH Training, Research, and Evaluation branch in the Education and Information Division. He also coordinates the NIOSH Small Business Assistance Program and Translation Research Program. We are going to
Okay, hi. Thanks, Heather. And thank you for the opportunity to speak to this group today. And this is a nice chance to follow on to the points that Bernie was just raising here. So I want to talk to you briefly about small business as a focus for occupational safety and health programming and outreach efforts. Just a little bit of background for you. If we think about small business in the U.S., this is, and there's lots of different ways of defining this, as I'll explain, but if we just think about how many people work for a firm with less than 100 employees, that's roughly 1/3 of the whole U.S. workforce. And the overwhelming majority of businesses in the United States are not just small businesses, but very small or micro businesses. And this is of particular interest to the OSHA community because, or the Occupational Safety and Health community, because research has shown us that smaller businesses endure a much higher burden of occupational injuries and illnesses than their larger counterparts. Now, this might not be necessarily shown in BLS injury data, often because of reporting difficulties at very small firm sizes, but there's pretty good research evidence to support this idea. Small businesses are important too because these are engines of job growth. This is where jobs are created, and increasingly so. Some projections are showing a long-term downward trend in U.S. business size, so we can imagine that that proportion of the workforce that's working for small businesses is only going to continue to increase. So as I said, what do we mean by small? If you mention small business to someone, there's a lot of different connotations that come to mind just with the concept, and we've tried to explore this a little bit here at NIOSH. So one way you can think about it is obviously number of employees or size, but other things that we like to think about there are concepts like resource slack. So it's not just how many employees do you have, but how much additional time or personnel time or people do you have to devote to workplace safety and health in your organization. That's one way we could think about small business. Another way to think about it is in terms of age of business. Research shows us that new businesses have a much higher failure rate if they're experiencing lots of injuries in their first few years. We can also think about it in terms of structure of the business, whether it's a sole proprietorship or a limited liability corporation. Some research shows us that self-employed individuals make up roughly 11% of the workforce, but they are much more likely to die from work-related injuries. And a significant proportion of the research on small business safety and health is focused on managers, mainly on their personality, their skills, and their attitudes on how that impacts safety and health in the business. So this overwhelmingly small print slide is meant to show you just the vast range of ways of defining small business in occupational safety and health research. So you can see in the top line there, ranging from a very small microenterprise of less than 5 employees in some studies, all the way up to less than 1,000, which I think most of us would agree a company with just under 1,000 employees doesn't really fit the bill of a small business as we would think about it in terms of resources for workplace safety and health. I'm going to skip over a little bit of this about cost of injuries because I think Bernie did such a nice job of covering this information. But the point here is that there's a clear value of investing in occupational safety and health and in safety and health programming, especially in small businesses. And there's all sorts of different benefits that we could point out here in terms of direct savings and indirect savings and benefits for employees and their families. But the bottom line is clear. Investment in workplace safety and health pays off for business and their employees and their employees' families. But now we run into the problem. The problem is that safety and health programs tend to be rather limited or non-existent, especially among smaller firms. So just as an example, some survey data that we did some analyses on, a national survey of small businesses. The survey data was collected by the National Federation of Independent Businesses. Really shed some light on just how much small businesses engage in workplace safety and health activities. And one of the big takeaways from our analysis is that size really matters. The smaller the business, the less likely they are to engage in safety and health activities. And just to give you an example of what some of these percentages are, overall, all of these small business respondents, roughly 80+% of them said that they conducted periodic safety inspections. So that's a fairly straightforward and simple safety activity that a business can do, and it turns out many of them do that. Now, how do we define safety inspection? That could be simply walking through and looking for hazards that are obvious, or it could be some sort of focused, sort of checklist-based audit. There's certainly a range there of sort of the quality of inspection, I would imagine. But if we move on to other activities, such as having a safety committee, out of all of these firms under 250 employees, less than 20% actually had an employee safety committee in the business. And that number got smaller as you go down in business size. Similarly, for sending employees to safety training in the last year, that was less than 10% of all respondents. So clearly there's deficits associated with just the size of the business as far as conducting safety activities that we would include in a safety and health program. So just to give you a flavor of what the research shows, as I mentioned already, there's a disproportionate share of occupational injury, illness, and fatalities among smaller businesses. The reason that there's fewer activities, there's lots of different reasons. One, as Bernie mentioned, is these businesses often are operating in a vacuum. They're isolated. There's a low probability of being inspected by OSHA. Things that are designed as interventions to reduce injury and illness often are designed for larger company settings that don't work for small businesses. And the workforce in small organizations tends to be younger, having more older workers, having less educated workers than the workforce in larger organizations, and managers have less experience, which includes less experience with managing workplace safety and health. So lots of reasons why the programming isn't there, but what are some other things we can think about? Well, as we're talking about today, the business case for workplace safety and health, especially for smaller businesses, our research suggests that that business case can include more than just dollars and cents. So really we want to think about workplace safety and health as an innovation in a smaller business, right? Because it's not necessarily something new, but it's something new to them in many cases, or expanded programming would be new to them. So we need to think about sort of the diffusion science side of approaching safety and health assistance delivery to small businesses. And some researchers have suggested we should really be taking kind of an ecological approach. So we're looking at different kinds of support in the community for small employers to improve their safety and health programming. And some have even gotten so specific as talking about local business councils in limited geographic areas, which has been something we've explored in our research here at NIOSH. So what this brings us to is really the need for market research to understand how safety and health for small businesses fits into what we would call the value proposition for suppliers of other goods and services to small businesses. So how does safety and health fit into sort of the value offering that organizations that serve small businesses can offer them? So here's just one example that I pulled from a report looking specifically at construction drivers of safety and health programming, and just to give you kind of an idea of how we could look at one piece of market research here. The question's asked, who's the most influential position within the company for improving safety? And if you look at those very small businesses, it's the owners of the businesses. And if you go down to safety personnel, it shows up as 0%. Not surprising, given there's probably no safety and health personnel in these businesses. But this tells us something about how to influence businesses at various size points. So what I have here is probably a little overly complicated model for how we at NIOSH have been thinking about reaching small businesses with safety and health assistance. So we know we as NIOSH or our colleagues at OSHA or any other large organization, AIHA, National Safety Council, we can't do this alone. We can't reach all of the millions of small businesses in the U.S. with safety and health assistance, but we can reach some really important partners or organizations that are already networked with small businesses. So I'm sharing this slide just to kind of show you this sort of two-stage model of how we could reach small organizations and learn about them better. And the key to that is understanding intermediary organizations. So many of you on this call are likely representing an intermediary that can influence small businesses. So these include all kinds of organizations, chambers of commerce, insurance companies are a very important one, trade associations, even financial service providers. There's a great example of testing out this approach in Denmark by having accountants deliver safety and health information to small businesses. And why would you go through accountants, you might ask? Well, it turns out accountants are one of those touch points for small businesses that nearly every small business has to come into contact with. So that's kind of a small example of what I'm describing here. Another example, just to give you an idea of how this has worked in practice, in construction, specifically focusing on trenching among small construction businesses who might be doing like plumbing or sewer installation in residential settings. We actually tried out assembling a group of intermediary organizations to deliver training to these small employers. And over a 2-day period, we were able to get 80 different small employers to attend a training on how to use trench boxes safely and pick them up safely, and all sorts of things associated with digging holes and people climbing in them. And our evaluation data was good. People liked the training. They got lots out of it. They planned to apply what they learned. But really our key indicator of success was that all of these project partners continued to offer trenching safety classes without NIOSH saying, hey, this is a good idea, you guys should do this. They saw value in doing what they were doing because it was attracting small employers and offering them value. So just some takeaways from this work. There's lots of potential consumers, right? The majority of employers are small. So if intermediaries can sort of expand their scope or their focus to include more small businesses, there's lots of consumers there. And in turn, employers, there's lots of intermediaries that you can get assistance from. Assistance needs to be focused, interactive, frequently available, affordable, which you might cross out and just say free in many cases. And it's important, I think, for initiators and intermediary organizations to take an active and participatory role in the community in which they're operating. So trying to identify champions and opinion leaders for improving safety and health and reaching small employers. Obviously, the members or clients of intermediary organizations are going to tell you how it's going to actually work with an intervention plan. And it's important to evaluate and provide feedback at all steps in the process here. And finally, try to keep the exchange balance. And what I mean by that, for example, is we as NIOSH don't want to put so much effort into one specific location that we're doing all the work and none of the intermediaries are taking this on and seeing value in it for themselves. And the same could be said for intermediaries working with small employers, that you're not the one doing all the work, that there's a balanced exchange there. And in closing, I just wanted to share a very exciting opportunity that many of you on this webinar might be interested in joining us for. This would be the first ever workplace safety and health conference specifically focused on small businesses that we're bringing to the U.S. This October in Denver. So this will be a great opportunity to hear from leaders around the world and what they're doing in workplace safety and health for small enterprises. And we really need practitioners and people that are out there doing this work every day to join us so we can learn from them. So I offer the conference URL and my email address there if anybody has specific questions about that. So I'll end there.
Great, thank you so much. Next, we're going to hear from Todd Holmes, a little bit about PG&E's safety journey. Mr. Holmes is part of the PG&E's executive team. He implements and delivers effective integrated health, safety, and operational learning programs across PG&E. He was the founder and executive director of UL's Integrated Health and Safety Institute. He's a U.S. delegate for the creation of the new ISO Global Standard for Occupational Health and Safety. And he is a certified safety professional and professional member of the American Society of Safety Engineers, who is a co-sponsor, and he's joining us as a representative from the National Safety Council, one of our other co-sponsors. So thank you so much, Todd. Welcome, and we get started.
Thank you, everybody. Good morning, good afternoon. Just want to take you a little bit through the journey at PG&E, specifically related to safety. And I'm having trouble advancing my slides, so somebody can skip it to the next slide. PG&E is a company that's based in Northern California, been in business since 1905. We have 23,000 employees in our company. Our territory spans from the Sierras Nevada mountains on the east to the Pacific Ocean on the west, up to the border of Oregon and down to Bakersfield, California. We serve 10 million customers. We have 300 physical locations. And while we're a large employer, I'm going to just share some perspectives of the things that we're doing that any small business can adapt and adopt to their operations to improve safety across their enterprise. Let's skip to the next slide. When we think about PG&E, we're on a journey to really implement a safety management system for our organization. And the safety management system really comprised of the Plan, Do, Check, Act model. And from a small employer perspective, you may not be ready for an SMS, but there are things that you're doing or could be doing to improve safety for your organizations. Our program aligns with the Illness and Injury Prevention Program in the state of California. It has elements of leadership and employee participation. There's a planning component and execution operations, an evaluation and corrective action, and we also have an executive safety committee that weighs in on a monthly basis comprised of our executives related to our performance. In terms of the plan components of this, we're talking about really hazard identification. What are the exposures that we are encountering in the field or in our office environments or in our motor vehicles that we're driving through our territory that could create a hazard for us? We document those either in a job hazard analysis, job safety analysis. When we begin our work, we start all of our work with a pre-job briefing. We call it a tailboard. You may call it a toolbox talk or something else in your organization. Our crew leads and supervisors are responsible for providing coaching and feedback to our employees to ensure that the operations or the jobs are set up properly. And then post a job, we'll do a post-job debrief to make sure we understood how the work went. Did we encounter anything that we didn't anticipate, and overall any lessons learned that we can get from that activity. In terms of the do component, we have field safety specialists that are regularly out in the field conducting inspections and observations of our crews, our contractors, looking for public safety issues, as well as looking at compliance issues to ensure we're in compliance from a regulatory perspective. Those inspections are documented. We have technology that we capture them on, and so we have transparency and visibility on a daily basis that not only the amount of inspections that we're performing, but also the conditions that we're finding. When there is an event, we also have an investigation team, and all of our crew leads and supervisors have responsibilities for investigations. And in some instances, they would include a causal analysis or a root cause analysis to determine and understand what are the findings and what are the corrective actions. In terms of the monitoring component, in addition to the job site inspections, we also look at our post-performance, i.e. our injuries and illnesses that the organization is experiencing to understand how we compare to our peers and utilities, but also how do we compare to organizations across the country. And then the ACT component, we have a pretty robust corrective action program where anything we identify is submitted into this corrective action tool, and then those deficiencies that are identified have to be corrected, and then there's a verification process to ensure that they're correct. All of our leaders, from crew leads up to our executives, go through regular annual safety training, and on June 8th of this year, we're going to do an executive workshop where our CEO, COO, our SVPs, and the vice presidents will spend the day from a safety perspective, just honing, enhancing their skills related to safety for PG&E. Can we go to the next slide? What I'm also going to share with you on this next slide is we're probably doing things a little more advanced in some organizations. And so we have a pretty robust workforce health, workforce well-being promotion program. And really what this is about is helping to ensure that our employees come to work, are physically healthy, can perform the work that they need to perform. We maintain safe work sites and jobs, so when people go home, they go home in the same condition that they came to work in. And so we're trying to create this holistic lifestyle, and we have a number of physical health support mechanisms for our employees, including health screenings, health coaching, tobacco cessation programs. We also focus on emotional and social health, and then we have access to clinics within our network, as well as in some of the facilities that people can go and see a doctor, whether it be occupational health related or their personal well-being. And the reason we invest in the health promotion side of our business is that we have found, and national statistics show this as well, that individuals that make poor lifestyle decisions and or have chronic disease conditions have a higher propensity of being injured on the job. And these conditions consist of hypertension, type 2 diabetes, obese, overweight. And so there's a contributing factor to whether someone's going to be injured on the job. And what everybody needs to understand, regardless of what size operation you have, is that 50% of the working population in the U.S. has one of those conditions, and 50% have two or more. So from a safety and prevention perspective, we really need to start aligning around employee well-being and safety in order to have a greater impact on whether people are injured. Next slide. So in the last year, we've embarked on a strategy of really focusing on aligning the enterprise around what are our safety and health goals. So we're conducting loss analysis across the enterprise, drilling down to the lowest level to understand what are causing our injuries within our workplace. We're benchmarking not only within the utility sector, but benchmarking across the industry. National Safety Council helps us in terms of their data that they're pulling together related to not only accidents that are happening on the job, those injuries that happen outside of work, as well as motor vehicle information. We're also advancing our data to really start to drive predictive analytics and developing an integrated health and safety index to help focus our attention and focus our resources on the limited, around the things that are causing the most loss for the enterprise. We also spend a lot of time communicating safety and health. What I would encourage everybody to think about is more communication is typically better. So you got to have frequent communication, but you also need to have diverse forms of communication. You can't just rely on email or bulletin board information. You need to look at the types of workers that you have working for you and how they consume information and make sure you're delivering it in multiple formats. We're creating one PG&E plan for the next 5 years related to our safety and health and cross-cutting risks. And we're developing a number of dashboards to have real-time information available to everybody in the organization. So if you go to the next slide, this is really an example of the dashboards. And where we're really trying to focus attention is moving more upstream, or what we call leading metrics. And we capture metrics on a variety of fronts, whether it's motor vehicle, whether it's our audits, inspections, whether it's people that are going to see the clinic, people that are reporting injuries on a timely basis, and we define that as within 24 hours. And this information is available in real time to our executives, to our leaders, to help understand where we have opportunities to improve, and more importantly, the actions that we need to take to drive that improvement. And as we build in more predictability components, we'll have those shared as well in terms of our dashboard capabilities. So the next slide. We have a number of tools, and what I would encourage small employers, this is an example of just all the information we have available on our intranet site related to safety. But from a small employer perspective, OSHA has a tremendous amount of information, NIOSH, National Safety Council, all of their information is available for free. And so I encourage everybody to go to those websites and look for that information and help understand how they can apply it within their entities. My last slide, if you skip the next slide, is really just around the aspect of our work with National Safety Council. And as I already shared, we've partnered with them on a variety of fronts, but primarily it's motor vehicle is where we're most recently working with them, as well as helping us in our benchmarking initiatives. But in terms of their journey to safety excellence, they offer free safety assessments, free employee safety perception surveys, and an instant rate calculator. And that can be all accessed at nsc.org/journey. So again, take advantage of these free services regardless of where you're going to get them. And I'd also encourage you to talk to your insurance companies where you place your insurance, because they also provide a wealth of information. So that concludes my presentation. Thank you.
Thank you very much, Todd. We realize we're not going to have as much time for questions as we thought, so if you type in a chat question, we can try to email you back, or you can always send an email to safeandsoundcampaign@dol.gov with any questions or to get some additional information. Now, Deputy Intermediaries. He is Deputy Director of the Directorate of Standards and Guidance here at the Occupational Safety and Health Administration, and he's going to talk a little bit about how you can participate in Safe and Sound Week.
Great, thank you, Heather. So the important thing out of this whole webinar is you didn't come just to listen to us talk. We're hoping that you're going to actually go out and do something for Safe and Sound Week, which is coming up that second week in June, the 12th to the 18th. And I'm going to give you a very quick tour of the resources that are available on the website to help your business do something around safety and health programs. Again, this is the type of thing that a workplace with a mature safety and health program can use to highlight the good things that you're doing, or a workplace that has really no safety and health program or a poor safety culture. This is the sort of thing where you can dip your toe into the pool and get started at improving your safety and health culture. Now, this page that we have up now is our landing page. You'll see on the upper right-hand side there's a quick 30-second video that you can use. And we've got a Twitter feed where we link to many of the OSHA partners that are up there, that are co-sponsors in the campaign, with tweets that they're putting out. And then coming up during Safe and Sound Week, if we have individual businesses that are doing activities and want to promote the sorts of things that they're doing, if you can get one of the co-sponsors or partners to tweet it, we will retweet it and get you some recognition out there as well. Now, if you scroll down on the web page, we've got a map where people can register their events, and we're going to click on the register your event, and that just allows you to put in a couple of pieces of information. You can either just put in your business name and say we're doing something, or if you've got a sort of free activity, a webinar or a training session or something like that, you can register that and it will be open to the public and we'll provide that information. If we can go back to the map, let's check out, for example, Kansas. And you can see that later this week, the governor of Kansas is going to be doing a proclamation on Safe and Sound Week. And then as you scroll down, you can see a couple of folks that are participating. If we go to Texas, for example, you'll see again that there are events and participating companies. And one of the things that's pretty cool is we have this globe section on the bottom. We had folks from foreign countries and a U.S. Naval Hospital in Italy that's participating in Safe and Sound. And then also to the right of that, where we've got the national events logo, if there are webinars that are of the national events that you can sign on for, we'll have those listed there as well. While we're on the home page, if we can go back up and click on the co-sponsors and partners. So we've got the co-sponsors, OSHA, NIOSH, ASSE, AIHA, and NFC. And then as we scroll down through the partners, you'll see there's a very wide variety of organizations that have signed on. The American Chemistry Council, a number of construction groups, the Joint Commission, the American Red Cross, the OSHA Ed Centers, the U.S. The Chemical Safety Board. So you'll find a very wide variety of organizations. If you belong to an organization that's not up there and you think that they support safety and health programs and good safety culture, please encourage them to contact us, and they can do it at the Safe and Sound at dol.gov email address. Now, when you're planning an event, it's very easy. Step one is picking your activities. Now, you don't need to do all three types of activities, the management, leadership, or work, or participation, and find and fix hazards, but we encourage you to, and we've made it very easy. So let me pick, for example, on the work, the management leadership, let's click on the establish a visible presence. Now, there's a one-page fact sheet for each of the different types of activities. So there's a couple of sentences on what is management leadership and why is it important. And then it gives examples of how you can do it during Safe and Sound Week. So it can be as easy as having senior leaders or owners of the company walk the plant floor and talk with employees about safety. Or hold a short safety meeting and talk about the company safety policies, reporting procedures for when people get injured, any upcoming trainings or improvements. But the key thing is that you give a message that shows that the senior leaders, the senior managers, the owners of the company care about safety and health. If you don't like the activities that we have, we're very open to you picking your own, as long as it gets to that element of management leadership. Now, we keep scrolling down. We give you some tips on how to make it effective, and then, very importantly, how to show your commitment. Part of the message of safety and health, of Safe and Sound Week, is showing your commitment so that the workers get the message that the senior leaders in your business care about it, and that it's communicated not just to the workers, but all of the workers. So if you have multiple shifts, making sure that you're not just talking to the day shift, but you're talking to the night shift or the folks that are working on the weekend, that you're talking to contractors and other vendors that come into your workplace, particularly if you're a multi-employer workplace, if you have temp workers, if you have contractors and vendors who are part of your supply chain that are operating in your workplace, that everybody's getting the message that you care about safety and health. Now, if we can go back, we have other reporting tabs for worker participation, and then again for find and fix, where there are PDFs, one-pagers that you can download, similarly organized to tell you what it is, how to do it, and how to make it effective. I encourage you to go and look for those. Again, these are the sorts of things that will get you started on a safety and health program, or the sorts of activities that can reinforce the things that you're already doing. In step 2, once you've selected your activities, we have an event in a box. So we have all kinds of tools that you can use, including organizing checklists, agendas, graphics and logos, customizable communications. So let's click, for example, on the safety and health agenda, and we give you a sample agenda that can talk about what you could do to suggest what a quick meeting would look like for an all-hands meeting on safety and health. You don't have to use it, but it gets you at least pointed in the right direction with ideas that you can do in your business and are the types of things that can be easily done within a relatively short amount of time during that Safe and Sound Week. Let's now, for example, also click on, if we go to the press releases in the customizable communications. Part of what we're trying to do is, again, get the word out that your business cares about safety and health, not just to your employees, but to other people in your community, to your suppliers. This is an opportunity to show your commitment to safety and health and to exercise leadership and put your business in a positive light. So we've got a sample press release that you can put out where we give you some stock language and then suggestions about how to personalize it. And then we've got quotes in there that you can drop in from either OSHA, Dorothy Doherty, our Deputy Assistant Secretary, or the National Safety Council, or ASFE, or AIHA. So you've got quotes that you can add to your local press release to try and get the word out. We've also got information on social media. We've got some tips. We're using, again, the hashtag Safe and Sound. If you use that hashtag in your posts for the activities that you're doing during that week, we will try and find those, or you can get them retweeted by a professional society, trade association, or anybody who's one of the co-sponsors or partners. We will get it out on the OSHA national feed and put it up on our website. So we've got some tips and tricks that you can use for social media around Safe and Sound. We've also got some recruitment tools. And again, part of this is not just getting the word out for your business, but engaging other employers if you're on a multi-employer work site, others in your supply chain, others in your community or profession. Again, this is an opportunity to exercise leadership, to put your business in a positive light. Now, once you've done at least one, but hopefully 3 of the activities, again, something on management leadership, worker participation, and finding and fixing hazards. You'll come to this tab later this week. You'll be able to register your event and get a customizable certificate for your business that you can hang up, and web badges that you can put on your website to, again, show your support for safety and health and show that your participation and leadership in safety and health. One of the things that we'll be doing when you come here is we're asking for any folks that are interested in telling good stories about successes to please let us know, and there are opportunities to get the word out either through OSHA quick takes or blog postings or follow-on work to publicize the good things that you're doing. And again, we're looking for businesses small and large. We're looking for businesses in all different types of industries to show that safety and health is not just something that large businesses do. It's not a mythical creature. It's the sort of thing that all workplaces can do regardless of size. Now, if you need to contact us with any questions, you can click on that link, or you can use the Safe and Sound at DOL.gov, and that goes to us. If your business would like to register an event, you can register an event. If you have questions, you can send us questions. If you are a trade association or professional society that would like to sign up as a partner, we'd love to hear from you there as well. And with that, I think we're ready for questions.
Thank you. At this time, if you'd like to ask a question, please press *1. You will be prompted to record your name. If you'd like to withdraw the question, you may press *2. Once again, if you'd like to ask a question, please press *1, and please record your name when prompted.
And before we go to questions, we will have this webinar up on the homepage for Safe and Sound Week in the coming days, so you'll be able to get access to the presentations and you'll be able to get access to the full recording of the webinar. Do you have any questions from the phone line?
Yes, one moment, please. One moment. I have a question from Gary Smith. Your line is open.
Yes, thank you very much for the presentations this morning. It's very helpful, and we look forward to sponsoring and going forward with a safe and sound message. I did have a question, though, with regards to the program itself. And working with hazardous materials, we've worked with a person, his name is Dr. Peter Martin with Schneider Electric, who has developed a process called real-time profitable safety. And it's a method of monitoring on the day-to-day basis those critical factors associated with safety and production, matching production and safety as a kind of a comparable culture that or a collaborative culture where it's one rather than safety sitting off as a separate entity overseeing what's going on in the company. It links it, and then real critical to that is monitoring on operating windows and safety design windows and such. So I'm just wondering if there's from an industrial standpoint, especially with high risks and hazards, if there's any element associated with that that could be added to the offerings for the program.
Sure. Thank you. That's a great question. So this is going to be a little bit complicated of an answer. So Safe and Sound Week and the Safe and Sound campaign is about promoting safety and health programs, and that's what we're focused on there. The question that you talked about, we are addressing through OSHA's recommended practices. And actually, one of the things that we're planning as the next follow-on activity is looking at leading indicators for safety and health and showing how those are linked. So, for example, doing preventive maintenance and making sure that you're up on preventive maintenance could both increase the productivity because your business doesn't suffer downtime, but you also don't get machines that break down and then workers have to go in and put their hands in precarious situations where they might have an amputation, or machines that are breaking down more often, again, decreased productivity, and that might be where people are getting injuries because they're clearing jams. So we are very interested in those sorts of, that sort of correlation that you're talking about, but we're doing it not necessarily under the Safe and Sound campaign or Safe and Sound Week. We're dealing with it under our recommended practices for safety and health programs. Yes, that makes sense.
Yes, it does make sense. And in fact, tomorrow I'm hosting a seminar where PG&E is actually going to be a part of that, and we'll bring this up to them as a, as a group as well, that this is coming, that the recommended practices and leading indicators will be there. Okay, I appreciate that. Thank you very much.
You're very welcome. I think you're right on that. That's why it's safe and sound. Safe workplaces are sound businesses, because we believe that safe and health does make them a better business. You get better process control. You get better communication and coordination in your workplace. And I think your point is 100% on message.
Dr. Martin clearly defines a 3 to 5% increase in profit based on the real-time profitable safety model, so it works.
Excellent. All right, do we have other questions?
Yes, thank you. Our next question comes from Stephanie Nicholson. Your line is open.
Hi, my name is Stephanie Nicholson. I am a nurse. I work at Nazareth Nursing Home, Louisville, Kentucky. Thank you for this presentation. I'm also with our, I am an infection control preventionist within our facility, and I'm also joined by Nancy Zeman. She is an RN here as well, and she is our staff development coordinator and does our education for our staff. So my question is going to be related to employees of healthcare facilities. Based on the experience of the panel members and your knowledge of the tools that you have provided for us, are there any tips or tools that are better than others for engaging the employees of healthcare facility? We are both part of our safety committee, and we spend a lot of time walking the facility looking for facility hazards and whether or not our residents are safe, but we don't spend a whole lot of time talking about our personal safety. So that's my question.
So this is Andy from OSHA. Let me jump in. Thank you for the question. Healthcare is certainly a high hazard industry. We've done a lot of work on that. Now, not under the Safe and Sound campaign, but if you go on OSHA's A to Z index and you look up hospitals, we did actually a whole guidance document on safety and health programs in hospitals, talking about the linkages between worker safety and patient safety and giving examples of how healthcare institutions have implemented safety and health programs, because worker safety and patient safety really are two sides of the same coin. Particularly if you're looking at, as you mentioned, the infection control issues, and transmission between workers and patients, and then back to workers, and then to other patients. So, you're onto something really, really good. The other thing that I would say is, in our work with healthcare institutions, particularly hospitals, there's a good linkage between safety and health programs and the high reliability culture activities that are going on in healthcare. And we talk about how there are some linkages there and how some of the language and the approaches that are used in both high reliability organizations and safety and health programs reinforce each other. So again, if you look at that A to Z index and you look up hospitals, you should find some good information on safety and health programs at hospitals. And we have some work that we did with CMS on that.
Okay, thank you very much.
You're welcome.
Thank you. And once again, as a reminder, if you'd like to ask a question, please press *1 and please record your name when prompted.
All right. We'll give it another minute. I know that we're a little over time right now. Again, if you have follow-on questions, that Contact Us tab at the very bottom of the homepage for Safe and Sound Week. is a great way to get a hold of any of us. We have 3 different people that look at that email address every day, and we will get your question to somebody who can answer. Operator, did we get any more questions coming in, or can we end the
Yes, I do have an additional question here. One moment, please. Okay, I have one person that didn't understand your name. Please go ahead with your question. Your line is open.
Yes, my name is Rafael. Calling from Puerto Rico. How are you? The question that I have is related to information regarding most common safety and health issues, thinking specifically about office scenarios. That's one question, and the other one is if there's any statistics that I can find regarding the link between pre-existing health issues and accidents at the workplace.
So at OSHA, because most of our folks in the national office work in an office environment, we're doing Safe and Sound Week ourselves, and the Department of Labor is also participating in Safe and Sound Week. So what I would suggest is look at your OSHA 300 log or your work comp information for how people are being injured in your workplace. For us, in terms of hazards, what we're focusing on are things like slips, trips, and falls, either wet floors, cords on the floor, if people have personal heaters, fire safety issues there. We are looking at ergonomic issues. People spend a lot of time staring at their screens and typing on keyboards, and sit-stand workstations. We're focusing on emergency evacuation procedures. So even if you're in an office environment, there are the sorts of things that you can do to talk about safety and health. There's also a good opportunity to talk about wellness. We're doing things around weight loss and around exercise and encouraging mobility. And in fact, we have a challenge going on for our employees right now where people are teaming up in a buddy system and they get points for a variety of different health promotion type activities. So that's another good thing that you can do in an office environment. The other thing that you can do is organizations like the National Safety Council have things that relate to home safety, so you can tie in things like fire safety or driving if people have to drive for work, or fire safety with kids, or safety in bathrooms and bathtubs and that sort of thing. So that's also a really nice tie-in to complement the things that you're doing at work as well.
Thank you.
At this time, I currently show no questions.
Okay. All right. Since we're well over time, thank you all to the presenters who joined us. Thank you all on the phone for joining us. Again, the webinar will be up on this homepage, the Safe and Sound Week homepage, if you'd like to view it or share it with folks. We've got the 30-second video that you can look at on the homepage, and we hope, most importantly, that your business will do something for Safe and Sound Week to get the word out and show your commitment to safety and health.